The following portion of Studio 512 is sponsored by Renaissance Women's Group. Are you or a loved one expecting this year? Dr. Shayla Patel, OBGYN with Renaissance Women's Group, is here with some tips for pregnant women. And first of all, I want to say congratulations to any expectant mamas out there. And we're happy to have such expertise here in the studio. So Dr. Patel, let's talk about what a pregnant woman should avoid when we come to the idea of eating.
So the main thing to avoid is bacteria that can be harmful in pregnancy. And so that would be, you'd want to avoid any raw or uncooked meats, seafood, or eggs. You want to avoid unpasteurized milk or cheese. So some of that can be some fetas, some blue cheese, and queso fresco. You want to avoid deli meats unless they're microwaved or cooked so that you can kill the bacteria. And then you want to limit seafood, I usually say, to 2 to 3 times a week to limit mercury toxicity. And that would also includes limiting or avoiding, I should say, the bigger fish, such as like a king mackerel, big eye tuna, shark, to limit that mercury toxicity.
Let's talk about the benefits of exercise during pregnancy, because especially for first-time moms, you're going to ask your body to do something it's never done before.
Yeah, so there's many benefits to exercising in pregnancy. The main ones I always counsel about is that it decreases the risk of gestational diabetes, preeclampsia, and decreased risk of C-section, which is very important to people. It also decreases their low back pain and improves constipation, which are 2 very common symptoms in pregnancy. It helps them to maintain a healthy weight in pregnancy and avoid excessive weight gain, and then which also helps them after the baby's born to lose the weight.
Absolutely. Yeah, and I hear a lot about abdominal wall separation. So are there any types of exercise that are, safe that maybe a doctor would say, okay, these are the ones that I would suggest?
Yeah, the main things, or the main ones we recommend that are safe are walking, brisk walking, yoga, swimming is a really good exercise, and then stationary bicycling. And we recommend about 30 minutes, 5 times a week of moderate level activity.
How about any exercises to avoid? I'm going to make a guess that you're going to tell us don't go too hard.
Yes. And so exercises to avoid would be anything that can increase the risk of harm or injury to you. So contact sports like basketball or soccer, skiing, scuba diving, skydiving. But I will say that for patients who do exercise regularly, like running, jogging, weightlifting, any racket sports, as long as they've been doing it before their pregnancy, they can continue to do them in their pregnancy. Of course, as long as, if they have any symptoms, pelvic pain, bleeding, to stop it immediately.
Dr. Patel, wonderful advice today. Thank you so much.
No, of course. Thank you.
Learn more about services provided by going to renaissancewomen's.com. The preceding portion of Studio 512 was sponsored by Renaissance Women's Group.